Hey there, and welcome to Lunchtime Live at the Center, where we talk about important fertility-related topics to inform and support your journey to having a baby. My name is Ami Choksi, and I'm your host. Now, there are many different paths to parenthood at the center, and we help families every day realize this dream. For the LGBTQ community, there are some additional options to consider and understand. And the center is an open and friendly place to the LGBTQ community. In fact, of the 13 to 14,000 born to from the beginning of our program, there are about 1,500 that were born to the LGBTQ community. So, and today we're talking to Kathy Paniati, who is our third-party reproduction manager, and she's here to share about the options that are available within the LGBTQ care program at the center. And she's taking your questions as well. Kathy, hi, how are you?
Hi, I'm fine. How are you?
I'm great, thank you. Kathy, can you talk a little bit about your role as a third-party reproduction manager and what you do here?
Yes. So first of all, I'm a nurse. Um, Third party implies that we need more than two people to have a baby. And I think our LGBTQ community realizes that perhaps more than anybody. We need extra people. The people may be egg donors, they may be sperm donors, they may be gestational carriers. So anybody who needs a third party would come to me, and I would work with your doctor to develop a treatment plan that works for the type of family building that you're looking for, and follow you from beginning to end of your cycle.
Okay. So who do we treat within the LGBTQ care program and within the community?
We treat everybody. So we treat lesbian couples and singles. We treat single gay men and gay couples. We treat transgender individuals in their family making, and also in regards to fertility preservation prior to surgeries. We treat gender fluid people. We treat people. We know there are so many avenues and so many definitions of family, and we treat people. Period. I think that's as descriptive as I can get. We treat everyone.
I love that you say that because it's just very it's a welcoming environment, and I know that the center has a history of being a welcoming environment. In fact, our CEO is a gay man. So it just I love that you say that. Now, what about transgendered individuals? Do we work with transgender as well?
We do, for sure. So sometimes we meet them as young as early teens. We have a recent collaboration with Connecticut Children's Hospital in guiding and helping people realize their identity. So prior to surgery, we assist with reproductive tissue and gamete preservation, so that as somebody transitions, they retain the ability to have a biological connection to their future children. And it starts as young as the teenage years. We treat transgendered individuals, whether they have had surgery or not, in their family building in whatever way they present to us, with a partner, without a partner. Anybody who comes to the center and makes a first phone call, we would love for you to be as specific with us as to what your family building desires and needs are. From that very first phone call, it helps us guide you to an appointment that best suits your comprehensive needs. From there, our physicians and nurses and advanced nurse practitioners will thoroughly evaluate all members of the party, either a single or a couple, and eventually the third parties, to make sure that your needs and desires can come to fruition medically. We may find something during evaluation that may lead to another direction. We may offer even more options than you thought were possible that may lead you to come to a different direction. But it's a psychosocial, it's a medical, it's a psychological collaboration with all of our practitioners here to guide you to the best family making possibilities.
Okay. Now,
There's a million.
before we talk a little bit about the options, what would someone need to know if they called us, and what are some of the steps for getting started?
So the first step to getting started is making that first phone call. You will be asked demographic information. We'll ask you your name. We'll ask you preferred pronouns. We will ask you your sexual orientation. And we'll ask you about your partners. Following that first phone call, we will transfer you to a patient care representative who will best schedule your appointment in regards to what your needs are. So from that very first moment, like I said before, we want you to let us know what your family building plans are, and we'll make you an appointment that suits your needs. We want you to be, again, as clear with us. We want to help you. I think we're really good at treating every person. We're excited to do this, perhaps in particular for our LGBTQ community. It's such a deliberate and planned path to familyhood. We get excited being able to help you out because we know that for so long, this may not have even been a thought of a possibility for some of you. So just be clear, and then we will schedule a consult with our physician, who will then determine screening tests, prerequisite lab work, and you will be assigned a nurse to go through the process with you. So that's the basics.
And is there a physical assessment that
there is a physical assessment for most of our patients. So for our male patients, there is no physical assessment other than a semen analysis. So you won't be having a full body physical. We want to see the parameters of your sperm, basically. So that would be a test for the males. For female or patients who have female reproductive organs, we would do a vaginal ultrasound to look at your ovaries, to look at the uterus, to make sure that, again, everything's in good working order and that we can help you.
Okay. And can you talk a little bit about, is this typically covered by insurance?
That's a good question. I don't know if I would say typically. It sometimes is. And I'm going to give a huge plug to our financial service representative in the third-party program. She is so committed and will fight for every penny that is within your policy that you or your employer may not even know about. What we're finding lately, and I want you to take advantage of this information, the world, although we are behind and having equal rights for everybody, the world is changing slowly but surely. And there are workplaces, companies, policies out there that may have coverage for shared conception cycles, for gay men to have children, for lesbians to have children, or for people to adopt and use gestational carriers. Your employer isn't going to scream it out to you. But if you take a careful look, Dawn, our financial service representative, is going to take the most careful look and find anything that is available to you. So please ask your human resources department, your employers, and your insurance company to really spell out your benefit, because we're finding more often, not as often as we should, but more often that there may be some money worked into your policy that you may not know about.
Oh, that's good to know. That's good to know. And what else is required? There's a psychological consultation?
There is, depending on the cycle plan, there usually is a psychosocial consultation. It's an educational session. It's not an evaluation of any kind. Lots of the gay community need a donor of some sort, and there are particular things we want you to think about in terms of using a donor that have nothing to do with the type of family you'll become. It has nothing to do with your sexual orientation. We want to make sure that you all go into a donor cycle or a gestational carrier cycle with your eyes wide open about all of the what ifs, all of the things that we know about it, so you can make an informed decision up front and you're not left after the children are born with lots of, well, I didn't know this would happen, or we want you to just have as much information about the process as we possibly can from the get-go.
There's a lot of information and
there is.
Okay. So now going to options. So options for men. So for male partners or same-sex couples, what are some of the options for them?
So options for men, we obviously need an egg donor. That's one of the pieces that men need. It can be an anonymous or non-directed egg donor that you would find working with an agency. We screen our own egg donors here, and we work with some egg banks.
Okay.
Or, I forget if I said this, it could be somebody you know. You can bring a friend or a cousin or a sister to the party, and we could certainly screen somebody that you know to be your egg donor. And men also need someone to carry the baby. So in Connecticut, at least, and in most states in the country, you need a separate person to be the egg donor and the gestational carrier. So men need 2 extra people. And those are the options for men, along with fertility preservation for men who may be transitioning to female, for men with oncology needs. Perhaps they're a young man who unfortunately has been diagnosed with cancer. We can certainly help them preserve their sperm for future use.
And so when it comes to when they're ready to have children and they preserved fertility, what are their options at that point?
Their options at that point, depending on their sexual orientation, are to use that sperm, combine them with donor egg or eggs of their partner, and their partner would carry. Or in a gay male couple, they would then find the gestational carrier.
Okay. Now, so what are some of the differences then, or what are now options for women?
For women,
same-sex couples.
Okay, and in particular, we'll talk about lesbian women. So again, a single or a lesbian couple may come in and they want to do inseminations. One person may be very sure that they want to carry the pregnancy, and one person may be very sure that they never want to carry a pregnancy. We can do inseminations of donor sperm, again, either directed or non-directed, and do an insemination for one of them to become pregnant. Another possibility is for one partner to do IVF with donor egg, depending on her fertility needs. IVF may be on the table, and one partner can do that, certainly with donor sperm. Another fun thing that we do, I think, I always love these cycles, is our shared conception cycles, where both members of the same-sex female couple participate in the IVF process. So we do a retrieval of oocytes or eggs on one of the members, and we fertilize with donor sperm, that third party, and then the other wife or other partner carries the pregnancy. So they're both fully involved, and it's awesome. Sometimes they keep the roles separate. One is always the egg provider and one's always the carrier. And sometimes they switch roles.
And so so for men and women, I suppose, how involved are you in sort of the process of choosing donor sperm, donor egg?
Okay, I think I was going to say really, really involved. Like, if you guys come here, you're going to know me very well. Sorry about that. But we guide you. The doctors, myself, Dr. Kim Krohn, our psychologist, will guide you towards good decisions in terms of picking a donor. ultimately, you guys will decide for yourselves. The most important information we can give you is to have a good feeling about the donor. They're all going to look good on paper. They've all gone through a very rigorous screening, so you can trust what you see in sperm banks or in our profiles. Having a good feeling about the person that you are choosing to be your helper is probably the most important part. We're here to answer any questions along the way, but we want that to be a decision that you guys make together with our guidance.
I think people love guidance, especially during this time where there's so much information and it gets confusing, can be emotional. There's a lot of things at play.
For sure. It's a lot. It's a lot, and it never looks like it can work on paper. Perhaps, maybe never doesn't ever look good on paper, but it works.
We've seen it many times.
We're with you the whole time.
And for families of transgender individuals, we talked a little bit about men or who are assigned male at birth. What about females or who are assigned females at birth? What do they need to do prior to transitioning if they want to have a family with their genetic material?
Right. So I think, again, a lot of thinking will go into that. Hopefully prior to medication and prior to surgery, although many people who are assigned female at birth, even if they've started taking hormone medications, can reverse the effects and have eggs retrieved. But certainly, we would want you to start thinking about fertility preservation. Even if you may have no plan of having a family later, it's a nice little insurance policy to have your oocytes retrieved and stored for even possible or potential future use.
Okay. Kathy, is there anything else you'd like to share? You've talked to so many individuals, so many couples who are doing this. Is there anything that you would like to share with them in particular, that just to help them through this?
I think just that we are open. We're really friendly. I think we realize, and every day I think we realize more, the obstacles that you all have in building families, in getting good quality healthcare sometimes, unfortunately. We realize that we want to prevent as many obstacles as we can. We want to hear from you. We want to hear from you how we can make your care better. I think we pride ourselves on doing a really good job. We've been doing it since 1983, and I think our care is evolving as technology evolves and the world evolves. But the most important thing I want you to know is that we want to learn from you. If we're doing something wrong, if we're not quite hitting the mark, we want to hear from you, and we want to work on making our care better. That's, I think, the most important thing. We're a team. You guys are the most important parts of the team, and we need to know what you need from us.
That's lovely, and that's so caring. I mean, I can just feel the warmth coming from you, and
I love my job. I love my job. It's the best of all reproductive fertility worlds. We love meeting you guys.
So let me, and it's apparent in some of the comments. Kathy is incredible and so supportive. Hello, my favorite is how she addressed you, by the way. Andrea. Tara says, completely agree. She's the best. Lauren says, go, Kathy, go. We love you. You're amazing. Here's a question. How long does it take to coordinate these different cycles?
Okay, so depending on what your needs are, I would say the initial evaluation, start to finish, would probably take a month to 6 weeks. Okay. And then depending on insurance authorization and what type of third person you need, once all of the prerequisites are done, the cycle will take anywhere from 1 month to 2 months to complete, depending on your medication plan. So I hope that helps. So I would say probably start to finish, first phone call, to potential cycle could be 3 to 4 months.
Okay.
I think that's realistic.
Okay, great. And another one, she's our favorite, Kathy.
Okay. The only Kathy.
Um, Wonderful. Well, Kathy, it's always a pleasure to talk to you. So thank you for being here.
You too. Of
Yeah.
course. Can I say one more thing? I'm sorry.
Yes.
We want to let you know about the one big event that the Harvard Gay and Lesbian Health Collective is putting on, and I'm going to look for the date. It's in November. It's a virtual event. Please look it up. They're a wonderful organization that provides good quality resources, references, health. I won't think of the right word. Health information for the gay and lesbian community. This is their biggest fundraiser of the year. It is in November. I want to say the 14th. I might be wrong, but the Harvard Gay and Lesbian Health Collective. Please.
Yes, the 14th. And this year it's in a virtual event. So
it is.
I think their website is onebigevent.com. Sorry, onebigevent.org, and the center is a sponsor. There's one more question, actually. Can you talk more about the differences between known and anonymous sperm and egg donors?
Yes. So known, I'll first say we're trying to get away from the word anonymous and we're going towards non-directed because of the world we're living in. It's a very long conversation, but anyway, non-directed means somebody that you don't know. You go to an egg bank, we give you references. It's similar to a dating profile. You type in characteristics of an egg donor that you would be looking for, and you purchase eggs. A known donor is when you say, my sister would love to do this for me, or my neighbor has offered. That's somebody that you know. The medical process is the same.
Okay.
The screening process is the same as well. The FDA monitors and regulates all of this. So we need to go through the same type of screening processes. I will tell you, egg bank is cheaper than a fresh donor cycle. So finances sometimes come into play. So there are different levels of price points for depending, but known as somebody that you know and bring to us. Anonymous is somebody that you've never met, but has provided eggs for your use.
Okay. And again, this is something that you and Dawn help guide patients through as well.
We do, for sure, along with Dr. Crone, our psychologist.
Okay.
Yeah.
Excellent. All right. I don't think there are any more questions. This was great. Thank you so much. And we will be back next week for another Lunchtime Live. And in the meantime, if there's anything that you need help with, please go to our website, yukonfertility.com. Give us a call, and we will see you next week.
Thanks, Amy.
Thank you.